terms of how common it is amongst people who are experiencing homelessness, it really varies across the country. But here in LA, we know that of people with HIV, so kind of looking specifically at those folks, 23% report experiencing homelessness or unstable housing in the past 12 months. So almost a quarter, essentially. And why it's more common in this population is complex. There's many different factors. It's not just one single thing. Obviously, the housing in our county is very high, and so that just puts everyone kind of really at risk for unstable housing. But people living with HIV, commonly clinically we see that people have had really adverse childhood experiences or trauma. They may have some comorbid mental health conditions or substance use disorders, which put them at risk for having problems with employment, financial problems, and that would also contribute to unstable housing. And then there's other sort of more social reasons, which, HIV is still a stigmatized disease. And being gay or bisexual, transgender, which we do know that HIV disproportionately affects sexual and gender minorities, that those stigmatizing labels can put people at risk for falling out of relationships with their family and their community. And so then that means they have less social support when they're facing financial constraints. And then folks may be less likely to have adult children to help them as they age. So then these issues can actually even become more dire as people get older and have fixed incomes or low incomes, and they don't have as much social support. Just accessing public assistance programs can be so difficult, right? A lot of times there's a certain amount of paperwork and administrative sort of hurdles that have to be overcome, including having forms of identification, birth certificates, things like that, which, if you have been homeless and you've ever had your belongings stolen or lost or taken in a street sweep, like a cleaning sweep, it's really hard to replace those documents, and it takes time and diligence to do that. Folks just have basic competing needs, the more immediate needs that trump healthcare, which would be like food, shelter, and those things, are more immediate in terms of doing that. Lack of transportation, having, irregular cell phone coverage. Commonly we'll see patients who have cell phones, but they might not have a plan that's active, or they've lost it and things like that. And so not having a great way to communicate with their medical provider can also be a role. And we're lucky here in LA County. We have a lot of folks who are working to better understand the complex issues facing people experiencing homelessness. And one of my colleagues at the University of Southern California, Corinne Feldman, actually did a presentation a couple months ago, really sort of dissecting the role of traumatic brain injuries amongst people experiencing homelessness and how that actually can contribute to, sort of an inability to do a lot of it really affects the frontal lobe. And so then you're not able to really kind of keep calendars and really, plan to go to appointments. And we know that the healthcare system's pretty rigid with regard to that. Traditionally, right, you have to be somewhere at a certain time or otherwise you won't be seen. And so that those are some of the reasons.